Good morning, good afternoon, good evening, and welcome to the 2021 Global Handwashing Day celebration. I'm Ann Thomas, the Sanitation and Hygiene Global Lead at UNICEF, and I'm very excited to be emceeing this event this morning. We have a large group joining us from around the world, and so I'd like to start with the very first important piece of information about joining in different languages. We have both French and Spanish translation today. For those of you who would prefer to listen to the session in Spanish, please go to the bottom of your screen and click on the interpretation icon at the bottom and choose the Spanish channel. For those of you who prefer to listen to the session in French, please click on the icon, the interpretation icon, and click on the French channel. It's also important that you click on mute original audio so that you don't hear both the speaker and the translator speaking at the same time. So with that, we have an outstanding session today with participation from senior leadership around the world. And I'm particularly excited that we have voices today joining us from outside the WASH sector. We have representatives from labor ministries, refugees, and health. Today also marks the launch of the first State of the World's Hand Hygiene report, and this captures where the world stands with regards to hand hygiene, both the present opportunity and the urgent priorities going forward. We'll also hear from countries and corporations around the world as they share their commitments to hand hygiene. Before I turn it over to Kellyanne Naylor to open, I'd like to cover a few ground rules for the webinar. Audience members, you will be muted upon entrance. We'd be grateful if you could use the Q&A function at the bottom for your questions. There will be a chance for panelists to respond to these questions as we go through the session. And the session is being recorded for our note-taking purposes. We have a tight agenda, so I'll be quite strict in enforcing time limits. I thank you for joining, and I look forward to a lively discussion today. I'd like now to turn over the session to Ms. Kellyanne Naylor. She is the Director of WASH at UNICEF. Over to you, Kelly.
Thank you, Anne, for the introduction. Excellencies, distinguished guests, and hand hygiene champions around the world. It's so great to see so many people connected from so many different countries. And I'm just wishing you a good morning, afternoon, and evening from New York City. And most of all, a happy Global Handwashing Day. October 15th is always one of my favorite days of the year, and I'm so pleased to be able to open this year's 2021 Global Handwashing Day celebration. I've been looking back on the 12 months since we last celebrated Global Handwashing Day, and I'm just so struck by the remarkable progress that we've made together. In October 2020, the COVID-19 pandemic was still raging, and governments around the world turned to a simple solution: hand hygiene. We know now that hand hygiene is, of course, not the sole answer to stopping COVID-19 transmission, but of course, hand hygiene is always a good idea. COVID-19 response efforts and strategies created a unique moment for hand hygiene. UNICEF, WHO, and other leading organizations started the Hand Hygiene for All initiative, really with the aim of turning this unique moment into momentum. And this broad collaboration has seen partnerships strengthening around hand hygiene, including identifying research gaps and our understanding of hand hygiene and the mobilization of unprecedented resources around the world. Additionally, there have been increased collaborations to accelerate hand hygiene markets and new voices coming into this conversation, and a rallying cry for governments around the world to increase their leadership in hand hygiene. The theme of our event today, Accelerating Hand Hygiene Through Government Leadership, is of course then very apt, as there has been such a step change in government leadership of hand hygiene in this past year. Just last year, we launched the hand hygiene roadmap process, and today we have over 40 countries working on roadmaps around the world. We'll hear later about a selection of governments and their commitments to hand hygiene. So I'm particularly honored today And going to the first slide, to be able to launch the Hand Hygiene for All flagship report called The State of the World's Hand Hygiene. This has been a joint collaboration between the World Health Organization and UNICEF, drawing on the collective knowledge, experience, and reach of many agencies across the globe. It's a companion report that you might recognize from the 2020 State of the World Sanitation Report that was launched on World Toilet Day last year. It brings together recent findings from the Joint Monitoring Program, or JMP, and GLASS, and it brings together new insights into the current status of hand hygiene. This report has been released today. You might have seen it on social media, and you can find it on UNICEF and WHO website, so please check it out. Next slide. The report's message is clear. The world needs to accelerate efforts to center hand hygiene within all approaches across all settings, whether we're talking about homes, schools, healthcare facilities, markets, transportation hubs, workplaces, refugee contexts. It must be a whole of society approach to reach everyone and leave no one behind. We need to focus more attention on strengthening markets for hand hygiene products to ensure supplies and services are readily available, especially when we're facing external shocks, whether they're natural or man-made disasters. There is a strong need to dramatically improve data by relating hand hygiene practice across public settings to inform better public policy. But none of this can be achieved without the political will to champion hand hygiene programs and policies. I want to turn next to talking about costs and return on investment, which are key considerations in any important public policy decision. It's estimated that achieving universal hand hygiene by 2030 in all domestic settings will cost $11 billion. But it would yield significant health and economic benefits for all. When looking at what this means for the cost to governments for initial and subsequent hand hygiene programs, they would be estimated to be equal to just 25 cents per capita per year in the 46 least developed countries of the world. This is equivalent to only 2.5% of the median government health expenditures in these countries. Households would bear 73% of the costs because households are purchasing soap, water, alcohol-based hand rubs, and hand washing facilities. While these costs may appear daunting when aggregated at global scale, hand hygiene is a solid investment. One estimate places the economic savings associated with hand hygiene policies at, on an average, 15 times the cost of implementation. But now that we have an estimate of the costs and a firm understanding of the benefits, the challenge before us is finding the financing for universal hygiene. This will require negotiations at local, national, and global level among households, private hand hygiene providers, donor agencies, and especially governments. Which brings us to the next point that is very important in our report. As Anne mentioned, COVID-19 response efforts and strategies have created an unprecedented moment in time for hand hygiene. And I'd first like to make the link with the SDG 6 Global Acceleration Framework. I'm sure many of you might be aware of this, but for those who are hearing about it for the first time, this framework has been an effort launched by UN Water at the 2020 High-Level Political Forum to deliver faster results and an increased scale for SDG 6. Hand Hygiene for All is one of the very first initiatives that was launched under this global framework and is an area where we've seen real acceleration. Governments are at the center of accelerating hand hygiene and have a tremendous opportunity to show leadership that's required to make hand hygiene a public policy success story. And this is already underway. And I think we can just see by the map that outlines the countries where the hand hygiene roadmap process is underway. At the start of this year, we were at 36 countries. By June, it had grown to over 40 countries, and today we're at over 60 countries working together to lead this transformational change on hand hygiene. And I just want to congratulate the many people and organizations who are making this possible. And as the current pandemic has taught us, the time for action is now, for this generation and for those generations to come, while the world's eyes are on hand hygiene. COVID-19 is not the first nor the last pandemic. 5 specific areas where action is needed, and this is outlined in the report. The first I want to talk about is good governance. This is through leadership, effective coordination, and regulation, including clear policies on hand washing services and behaviors in all settings. Secondly is smart public finance. We need to ensure that the maximum impact and stimulate investments from households and the private sector. Third, we need to assess the current capacity with respect to their hand hygiene policies and strategies, identify gaps, and develop capacity building strategies based on the rigorous application of best practice. The fourth action, that governments should address the need for consistent data on hand hygiene in order to better inform decision-making and make investments strategic. And finally, and always one of my favorites, is that government and supporting agencies should encourage innovation, particularly on the part of the private sector, to roll out a right-sized hand hygiene solutions for all settings. Ladies and gentlemen, in closing for these opening remarks, we've seen tremendous progress in hand hygiene over the past year, and I feel we are poised even further for significant acceleration. As you'll see in our program today, many of the components are already here. A low-cost solution, widely available products, and strong buy-in on the importance of hand hygiene. It's really a global movement. There is so much that we are already doing together to move this needle ahead on hand hygiene for all. I'm looking forward to reporting on even more progress at the upcoming UN 2023 Water Conference that will take place in New York in March 2023. Let me add my thanks to those of you joining today's celebration, and especially to our speakers. I'm really looking forward to an exciting event to hear more about how governments are taking the lead in hand hygiene, whether it's from donor governments to ministries of the environment, labor, health, and water. It's really everybody's business. So let's keep up the momentum from this defining moment and join our forces together to make hand hygiene a reality for everyone, everywhere, now. Thank you very much, and back over to you, Anne.
Thanks so much, Kelly, for opening our session and for officially launching the State of the World's Hand Hygiene Report. And you can all download it and find it online. And my
Anne, I'm afraid you're muted.
Has pasted the link into the chat box. The findings from the report form the backbone of our structure for today's session and set our agenda looking forward. Continuing the focus on government leadership, I've been struck by the number of countries prioritizing hand hygiene in the past 18 months. In addition to the 60+ countries engaged in public policy related processes, we also have a number of outstanding commitments from the private sector partners that have been so involved in hand hygiene demand and supply creation over the years. Mr. Tim Wainwright, the CEO of WaterAid, will now introduce those commitments that we have captured in a series of videos. Over to you, Tim.
Okay, well, I will keep this quick because we've got some great statements coming up from countries around the world, which are much more important, I think, than the global. It's where the action is at the local level. But I wanted to just quickly say to everybody, a very happy Global Handwashing Day. Everyone knows, I think, particularly on this call, how important hand washing is. But I think we're all aware that we have yet to plan, finance, implement and monitor hand hygiene at scale across the world. And the last year, with COVID here hitting the whole of the world, has brought this even more into the public attention and highlighted the need for collective action to address this, and to bring together governments, private sector, all of us working together to prioritize hygiene. And we must not wait for the next pandemic. We need to act now to build resilient hygiene to prevent future health threats. At WaterAid, we remain committed to hygiene for all. It's one of our top priorities, and it's going to remain one of our top priorities. In the last year, in response to COVID, we worked across the world, and with many others involved, we reached 181 million people with uniquely designed hygiene interventions. And we were working with governments, usually government-led programs, partners, communities, the private sector, delivering hygiene services, water, behavior change, as well as systems to ensure sustainability. I believe the time now is right for governments to develop costed hygiene strategies. And this is about, well, it's about more than governments. It's governments, stakeholders, donors, and the private sectors coming together and making the investments to turn these plans into action, to prevent infectious diseases, lower healthcare costs, and build back resilient communities. And of course, there are many wider economic benefits if these actions are taken. Some governments have already developed roadmaps or strategies. Others are yet to start. And as I said at the very beginning, it's government leadership that's absolutely critical. So today, it's brilliant to be able to see video commitments from a whole range of governments as well as private sector actors. And I welcome them. And that's what we're going to be hearing from later in this session. And for now, I just wanted to wish you all a very happy Global Handwashing Day. Thank you.
During the 71st session of the WHO Regional Committee for Africa, the Minister of Health in Malawi proposed to the World Health Assembly a resolution on hand hygiene to promote concrete action, investment, and accountability to accelerate the scale-up of hygiene behaviors globally as an essential part of the efforts to achieve universal health coverage and to protect our health systems and economies from future pandemics. The Minister of Health in Malawi is committed to hand hygiene, and we call on other governments around the world to support a new resolution on hand hygiene at the next year's World Health Assembly. Thank you.
नमस्कार। खाने से पूर्व एवं शौच के बाद हाथ धोने से लाखों बच्चों की जान बच सकती है। भारत सरकार ने अभी तक स्वच्छता पर काफी निवेश किया है और हम संकल्पित हैं कि हर किसी को स्थायी स्वच्छता लाभ प्राप्त हो। हमें पूर्ण विश्वास है कि हाथ धोने का व्यवहार जन जन का व्यवहार बनेगा। धन्यवाद।
ما ودادوری میگیریم که تا سال 2030 دسترسی همگانی رو در بین اهالی و مؤسسات سوی تندرستی و حفظ اجتماعی با واسطه ها اسباب و لوازمات برای دستشویی تامین نماییم.
In Vietnam, we have been implementing the Master Communication Plan on water, sanitation and hygiene from 2018 to 2030. We will also include the hand hygiene component in the rural water supply, sanitation and hygiene by 2030 and the comprehensive strategy on COVID-19 response. And we try to achieve hand hygiene target by 2030.
Okay, fantastic. It's so great to hear all these commitments from around the world and really inspirational actions that are being taken by governments and that can lead us to universal hand hygiene. Thank you, Tim, for introducing all these inspiring government representatives who are accelerating the momentum around hand hygiene. Later in the program, we'll hear more commitments and more videos coming from other sectors who are also making universal hand hygiene a reality. And of course, government leadership is inclusive of all the world's governments, and we're honored to have a message from Wendy Morton, the Minister for Europe and Americas at the Foreign, Commonwealth and Development Office at the UK Development Agency. And she will share her reflections on hand hygiene and how it has aligned with the report's findings.
Hello everyone, I'm delighted to celebrate global hand washing with you once again. Last year, we heard an urgent call to action in the face of COVID-19. Hand hygiene was vital to fight this devastating pandemic. And 12 months on, we can celebrate the progress we have made and look to a brighter future. Around the world, people have heeded the message that hand washing protects them from infection. Together with social distancing, mask wearing and vaccines, it continues to protect us. But the State of Hygiene report published today shows that there is much more to do. 3 in 10 people still lack facilities to wash their hands at home. A quarter of healthcare centres lack clean water and sanitation. Poor people in developing countries are the hardest hit, particularly vulnerable groups such as those with disabilities. And providing those most basic things, soap and clean water, will help end the preventable deaths of mothers, newborns and children. Working together, we can make the change needed for good. And over the last year, we have seen that partnerships deliver. Governments, academics, private sector and NGOs, all of you here today, joined forces to deliver results on an impressive scale. The UK partnered with Unilever, the London School of Hygiene and Tropical Medicine, UNICEF, UNHCR, and many more to promote hand washing in 37 countries. Our simple, life-saving message reached more than 1 billion people. Health workers, teachers, and community leaders delivered it to women, girls, and displaced people in some of the hardest to reach areas. And we saw how important it was to be innovative. We lent on smart digital and media communications, informed by behavioural science. Through television and social media, loved and trusted personalities reached out to people directly and drove home the hand-washing message. One of my favourite examples was the Sesame Street characters, who made it fun and easy for children to keep their hands clean. And these campaigns led to quick and widespread changes in behaviour. But we all know how quickly a good habit can be forgotten. Strong and sustained messaging, together with accessible facilities, are critical. National leadership and coordination are also crucial. Strong institutions and policies backed by evidence and investment are fundamental. They are the key to unlocking corporate finance in ways that we've seen during the pandemic response. Hand hygiene campaigns are some of the smartest and most cost-effective investments we can make. They prevent a wide range of diseases. They protect healthcare workers and patients from infection. And over time, they pay for themselves. By keeping parents healthy and productive, we help them feed and care for their families. By keeping healthcare workers free from sickness, we help them save lives. By keeping children in school, we give them a brighter future. Each and every one of us has a part to play. Let's take the hard-won gains of the last year forward and keep the momentum going. And let's look forward towards a world where hand hygiene is a lifelong habit, for good, for all.
Thank you, Minister
Hygiene
Morton.
has been central to our wash and health programming before and during the COVID-19 pandemic in Nigeria. The government of Nigeria is currently finalizing the country's hand hygiene roadmap. We remain committed to facilitating the process of having the hand hygiene roadmap get to its logical conclusion. We are working with all relevant stakeholders to ensure universal hand hygiene for all in our communities, schools, healthcare facilities, and in public places to achieve multiple sustainable development goals by 2030.
From Bangladesh, we have 3 commitments for accelerating hand hygiene for all. Those are launching the hand hygiene costed roadmap by the end of October 2021. Initiate to implementation of hand hygiene for all rebuilding phase within 2022. Achieving the SDG hand hygiene target by 2030.
يضمن شراكة حكومية لكل الوزارات العراقية المعنية، يضمن شراكة للمرأة وللطفل وللأسرة والوزارات ذات العلاقة في موضوع تحصين المواطن من الأمراض الناجمة عن التلوث الذي يحصل في اليدين. إن شاء الله ستكون خطوة مهمة نحو تحقيق الأهداف بإذن الله. تحياتي.
Government of Nepal is currently preparing the country-costed national hand hygiene roadmap. We are committed to start implementing it at national level by 2022. We desire to ensure universal hand hygiene in communities, schools, healthcare facilities, and in public places by 2030.
Indonesia is committed to achieve Sustainable Development Goal 6 to ensure access to water, sanitation, and hygiene for all. The Indonesian government, through the leadership of the Ministry of Health, is committed to developing a clear and actionable roadmap for hand hygiene for all by the end of this year, and rolling out the implementation plan by early next year. Salam sehat, sehat Indonesia.
So thank you, Minister Morton, for those remarks. And I think it's striking how many of us working in this sector now find our experiences dovetailing to a common point in need. And we've just heard many more inspiring commitments coming from around the world of hand hygiene champions in countries making this a reality. We were originally planning to have a case study from Pakistan showcasing the very strong leadership of government in pushing forward the roadmap for hand hygiene for all in Pakistan. But unfortunately, due to a technical issue, we've had to push forward on the program, and hopefully in a future session, we can revisit the Pakistan case study. So I'm going to now turn to, we have a set of video commitments, a third round of video commitments that we'd like to share before we transition into our panel discussion. So could we have our third round of video commitments air?
Astăzi, de ziua globală a spălării mâinilor, ombudsmanul copilului reiterează angajamentul său de a promova o igienă mai bună în instituțiile de educație din Republica Moldova. Astăzi este o situație gravă, deoarece 3/4 din copiii care locuiesc în zonele rurale nu au acces la servicii de calitate de igienă și spălare mâinilor.
ដើម្បីសម្រេចបាន 100% ការទទួលបាននូវសេវាទឹកស្អាតនិងអនាម័យប្រកបដោយនិរន្តរភាពត្រឹមឆ្នាំ 2025 ក្រសួងអប់រំយុវជននិងកីឡាបានដាក់បញ្ចូលបច្ចនាករទៅក្នុងវិស័យអប់រំឆ្នាំ 2019-2023 ក្នុងបរិបទជំងឺ COVID-19 អនាម័យដៃគឺជាផ្នែកសំខាន់មួយនៅក្នុងយុទ្ធនាការនិងវិធានការការពារក្នុងការបើកសាលារៀនឡើងវិញប្រកបដោយសុវត្ថិភាពខាងការសកម្មភាពជាតិស្ដីពីការគ្រប់គ្រងទឹកស្អាតការសម្អាតនិងអនាម័យជនបទ 2019-2023 បានកំណត់និងសម្រេចយក 90% នៅឆ្នាំ 2023 ក្នុងផ្ទះមានកន្លែងលាងដៃមានទឹកនិងសាប៊ូគ្រប់គ្រាន់ហើយនឹងសម្រេច 100% នៅឆ្នាំ 2025 ការរីករាលដាលជាសកលនៃជំងឺ COVID-19 គឺជាឱកាសសម្រាប់ឲ្យយើងពន្លឿននៅការលាងសម្អាតដៃនេះដើម្បីចូលរួមសម្រេចបាននៅផែនការដែលបានគ្រោងទុក
More
وظیفه‌دار می‌شویم که تا سال 2030 تجهیزات دستشویی گیگینی را در همه مؤسسه‌های تعلیمی جمهوری تاجیکستان تأمین نماییم.
I am Dr. Nityananda, School Medical Officer. Cleanliness of the world starts with your own hands. Infection control is in your hands. Please remember to wash your hands. Clean hands are healthy hands and caring hands. To control COVID-19, we have to make hand hygiene hand washing facilities accessible to all schools before 2023 in Jaffna.
Okay, thanks so much. And it's just really so encouraging to see all these fantastic commitments coming from around the world and really an inspiration. And now we have an opportunity to delve deeper into discussion with some government representatives who are charging forward on hand hygiene and making it a reality, and to field some questions. And to do that, I'm very pleased to have Clarissa Brocklehurst with us today to conduct these interviews with 3 sector leaders. Now, first, many of you may know Clarissa from her long history of engagement in the WASH sector. Among many roles, she was instrumental in establishing the Sanitation and Water for All initiative. She was a previous chief of WASH at UNICEF, and she's currently an affiliated staff member at the Water Institute at the University of North Carolina. In support of the Hand Hygiene for All initiative, she took on the role as managing editor of the State of Hygiene report and helped to bring in the contributions and perspectives of the various agencies involved in pulling it together. And we're very grateful to have her here today joining us. And joining Clarissa this morning are Mr. Arun Baroka, the Additional Secretary, Ministry of Jal Shakti, Department of Drinking Water and Sanitation in the Government of India. We have Licenciada Yolanda Cruz. She is responsible for occupational health at the Government of Guatemala's Ministry of Work. And finally, we have Mrs. Amina Helmi, the Deputy Director of the Environmental Hygiene and Environment Protection Department at the Ministry of Health in the Government of Tunisia. So I'd like to pass it over to Clarissa to lead us in this panel.
Thank you very much, Anne. It was a privilege to help pull together the State of the World's Hand Hygiene report, and I hope that our participants in today's webinar will be able to download that report and take a look at it. It's been a huge effort between WHO and UNICEF with lots of contributions from other organizations as well. So I'm very pleased to have the opportunity to talk about hand hygiene with 3 committed and engaged government leaders representing 3 different ministries. The interviews are going to be conducted in 3 different languages, so I ask for your patience as our hardworking translators do their jobs. They're going to be speaking in French, English, as well as Spanish. And at the end of this little session, we hope to have some time for questions and answers. So please post your questions in the Q&A box, if possible, the Q&A box, not the chat box. Someone's monitoring the Q&A and they'll relay questions to me to pose to the panelists. So please direct your questions to specific respondents to allow time for translation. I'm going to call on Mr. Baroka first, and then turn to Dr. Cruz, and then to Mrs. Helmi. So, Mr. Baroka, are you there?
Yeah.
Great. Great to have you with us today. I know that today is a holiday in India, so thank you, doubly thank you to you for joining us today. So national hand hygiene roadmaps feature in the State of Hygiene report, Hand Hygiene report, and UNICEF and WHO are encouraging governments to develop one. I understand that India is about to finalize its first hand hygiene roadmap. So I was wondering if you could tell us a bit about that roadmap. What kind of priorities are in it? How are you going to operationalize it? And what sort of first actions are you going to be taking under that roadmap?
Thank you, Clarissa. First of all, let me say that India has been consistently working on the hygiene promotion over the last 6 years as a part of Clean India mission. Locally in India, we call it as Swachh Bharat Mission, Swachh Bharat Abhiyan. So as part of this, and also otherwise substantial funds have been invested in sanitation and hygiene. And as a result, there has been substantial returns and gains on these investments. Furthermore, adequate emphasis has been laid on hygiene promotion, including hand washing in second phase of the Clean India mission. Probably you might be knowing that the first phase was over on 2nd October 2019. And then our foot soldiers who have been trained to promote hygiene, including hand hygiene, across all communities, schools, and health centers, they are working diligently. Then with respect to our department and also including other sister departments in Government of India and state governments together, like health, education, local self-government, along with the various partners, we have been focusing on promoting hand washing behaviors across the country through countrywide multilingual communication for behavior change. We have also made provisions to make resources available for setting up of the hand washing infrastructure. This has gone a long way to create awareness that hand washing and washing stations will remain a critical component of infection prevention and control. Furthermore, you might be knowing that government has launched a very ambitious program of Jal Jeevan Mission, which aims to provide water facilities, tap connections to all the households in the country by 2024. And at the national level, at the macro level, different departments which were working in different areas, they have been brought together under one ministry, which is Jal Shakti Ministry. Earlier, we were part of separate drinking water and sanitation ministry. With these efforts, I suppose the hand washing agenda becomes an integral component of the overall agenda of the government. Thank you, Clarissa. Over to you.
Okay. Great, thank you very much. So what I hear from you is that you are emphasizing both behavior change communication, but also infrastructure, making sure that water is easily available to people, and you're coordinating internally within the government. That's very impressive. And what advice would you give to others in other governments who want to champion hand hygiene? Do you have any words of advice for other governments hoping to do the same kind of, have the same kind of ambition that the government of India has had?
First of all, let me say that when we are working on the agenda of hand washing, it will have to be an integral part of the overall wash as such, water and sanitation. And now that has been done very effectively in Government of India. The ministries dealing with the drinking water and sanitation and overall the water resources, they have been brought together, integrated. At the national level, we are trying to do it at the state level also. When we undertook the sanitation mission, the Clean India mission, we ensured that we provide the hand washing funding facility also along with the toilet. That is the second thing. And the third thing is, when we are undertaking the matters relating to Jal Jeevan Mission, we are trying to ensure that water is available, particularly not only for general hygiene and general sanitation, but also for hand washing. And wherever we are having public tap connections, we are ensuring that hand washing stations are available, soap is available, and even if soap is not available, some sort of local disinfectant is available. So when we are working, we need to work together in an integrated manner and taking all the stakeholders, particularly the national government as well as the state government together. The most important thing is funding. If the finances are not available, then there will be a problem. There was a huge investment in terms of the sanitation. We invested almost about $1 billion on the sanitation, and now in the Jal Jeevan Mission, providing water to each household, there is another huge investment which is planned for, and the mission is working very successfully. And obviously, it has to be accompanied by a behavior change communication. So if you see, these are a few elements, but without the leadership at the top level, at the highest level, particularly the political leadership, it cannot move forward. So these are the few things which help us to move forward, not only in hand washing, but in all the different sectors. Thank you, Clarissa. Over to you.
Okay. Thank you very much. Very, very interesting. And thank you for sharing that with us. And if people have questions for Mr. Barauka, please don't forget to put them in the Q&A. Ms. Helmi, in the State of the World's Hand Hygiene Report, we learned that 1 in 3 healthcare facilities globally don't have hand hygiene facilities at the point of care. But I understand that in your country, in Tunisia, the situation is much better than that. And I think we'd like you to share with us how you achieved that. How did you set your priorities in order to increase hand hygiene in healthcare facilities, and what are you planning to do going forward?
D'accord. Merci beaucoup, madame. Je félicite. Donc, je félicite tous les pays pour la célébration de la Journée mondiale de lavage des mains, y compris la Tunisie. Tout d'abord, je veux, pour nous, au ministère de la Santé, on considère que le lavage des mains est d'une importance primordiale pour la prévention des maladies, de la transmission des maladies. Okay. Donc, comment on a pu arriver à ce stade-là? C'est grâce aux efforts multiples de tous les intervenants. On a une stratégie nationale de la promotion de l'hygiène au milieu de soins, y compris le lavage des mains. C'est une composante de cette stratégie-là. Donc, sur le plan, on a pu concevoir une architecture des agents hygiénistes, des professionnels en hygiène, sur tout le territoire. On a, sur le plan organisationnel, on a un département central et dans chaque gouvernorat, il y a un département qui s'intéresse à l'hygiène. Donc, on a un référent hygiène dans chaque gouvernorat et dans chaque gouvernorat, on a un groupement de santé de base qui héberge un hygiéniste qui s'occupe de tous les aspects de l'hygiène au niveau de ces centres de soins de santé. Donc, je trouve que très important cette architecture-là pour couvrir l'aspect hygiène dans tous les pays. Donc, pour le référent hygiène au niveau régional, c'est un expert en hygiène qui participe à l'élaboration de tous les protocoles d'hygiène et tous les guides à l'échelle nationale. Donc, c'est un référent tous les hygiénistes qui s'intéressent, qui s'occupent des centres de soins de santé, ils chapeautent. Donc, sur le plan technique, tous les hygiénistes, ils sont supervisés et chapeautés et assistés par ce référent hygiène. Donc, donc la même chose, chaque année, on fait un audit d'hygiène qui comporte plusieurs composantes, y compris la composante hygiène des mains. Donc, chaque année, on a un audit national qui nous avise sur l'état de l'hygiène des mains au niveau de ces centres-là. Donc, on voit qu'il y a une amélioration d'une année à l'autre, c'est grâce aux efforts déployés. Donc, on aura le résultat de cet audit-là et on programme avec les régions la promotion de l'hygiène des mains au niveau de ces centres. On a des procédures et chaque centre, il doit disposer de ces procédures au niveau de ces centres pour obéir à tous les aspects qui sont énumérés au niveau de manuel de procédure. Donc, de même, on assure la formation continue des hygiénistes, notamment en matière de l'hygiène des mains. Donc, on fait des sessions de formation, on fait l'assistance. Donc, aussi, pour l'hygiène de main, on n'a pas uniquement, c'est l'accès à l'hygiène des mains uniquement, mais on a, parmi la composante de l'audit, c'est savoir si on a un nombre suffisant d'équipements et de matériel qui peut nous permettre une hygiène des mains adéquate. Donc, ce n'est pas la présence ou l'absence, mais l'existence de façon adéquate, en nombre adéquat de ces dispositifs-là qui nous va permettre l'accès à l'hygiène des mains. Donc, c'est notre critère, c'est la présence de points de lavage des mains conformes en nombre suffisant. C'est notre critère qui est intégré dans l'audit. Donc, selon les résultats, donc on va communiquer aux directions régionales de santé, c'est la défiance détectée au niveau de l'audit pour pouvoir les programmer dans le budget de l'année qui suive. Donc, on fait le contrôle sur la qualité, comment ils ont abouti à réussir de satisfaire ces lacunes, ces défaillances au niveau des centres de santé de base. Donc, chaque année, on célèbre la journée nationale de lavage des mains en milieu hospitalier. C'est le 5 mai, on célèbre cette journée-là et on fait des séances de formation, de sensibilisation des opérateurs. Donc, de même, parfois, on achète des rubriques de lavage des mains comme pour célébrer la journée. Pour les résultats, donc on a, bon, c'est en moyenne, elle est satisfaisante, mais on a quelques régions qui présentent des indicateurs qui ne sont pas acceptables. On essaye d'améliorer et de remédier à cette insuffisance, à ces insuffisances. Donc, pour nos priorités à venir, on doit informatiser ces audits-là. Actuellement, on fait des audits manuels et ça prend beaucoup de temps pour synthétiser les résultats et développer la situation. Mais Inch'Allah, prochainement, on va informatiser les audits pour avoir une réponse urgente pour remédier à ces insuffisances. Donc, de même, on vise à avoir un budget annuel dédié au lavage des mains, assurer la formation continue des hygiénistes responsables au niveau de ces centres.
So what I'm hearing you say is that you have a very carefully constructed system of guidelines, of clear procedures. You have a dedicated budget, and you do an audit, a national audit. So congratulations on the work that you've done, and obviously it is bearing fruit. All right, thank you very much. And again, if you have questions for Ms. Helmi in Tunisia, please put them in the Q&A. And I'm very pleased to see that Ms. Cruz has been able to join us. Hello to you. I hope you can hear me. Can you just let me know if you can hear me, Ms. Cruz? I'm not sure if she can hear me.
Muy buenos días. Sí, la estoy escuchando. ¿Usted me escucha?
Yeah, I can hear you through the translator.
Aló, buenos días. ¿Me escucha? Disculpe.
I understand that Ms. Cruz, you are coming to us from Guatemala, right? And I understand that you're going to talk about hand hygiene in the workplace. Because in the State of the World's Hand Hygiene report, we pointed out that people spend a lot of their lives at work, and that if they don't have hand washing facilities there, they're both at risk as employees, and they also put the customers and the clients of their businesses at risk. So I understand that your government has taken steps to oblige employers to provide hand washing facilities at work. And I was wondering if you could tell us a bit about that. How did you do it? And does the law require employers to not only provide hand washing facilities, but also promote their use?
Sí, muy buenos días, muchas gracias. El Ministerio de Trabajo y el Departamento de Salud y Seguridad le da la bienvenida a todos. El Estado de Guatemala, viendo la necesidad de combatir la pandemia SARS-CoV-2, tuvo el compromiso de establecer políticas de Estado para la ley. Es la implementación de medidas sanitarias en todos los lugares de trabajo. El ente rector del cumplimiento laboral aquí en Guatemala, Departamento de Salud y Seguridad Ocupacional. ¿Cómo se hizo esa ley? Fuimos invitados por el Ministerio de Salud Pública y Asistencia Social para asistir a mesas de diálogo integrados por personales de 36-2020. Luego, a raíz de ese acuerdo, de trabajo. Por ejemplo, como algo esencial, primordial, es que se establece la habilitación de lavado de manos conteniendo agua y jabón. Asimismo, se promueven las campañas de información, motivación y sensibilización por medio de pictogramas, creando una cultura para su uso, ¿verdad? Entonces, muchas veces las empresas acá, pues también tienen el minuto de seguridad. Esto es para la motivación de los trabajadores, la sensibilización de los trabajadores.
So thank you very much to the translators for doing their best there, and thanks very much to Ms. Cruz. I think we understood what you were saying. I mean, this is a very interesting case in which the government has actually passed a regulation requiring employers to provide hand washing facilities. And so I think that that is a good example to have in front of us. I now have questions for both of the other panelists. Mr. Barroca, I'm going to go back to you first. We have a question about the funding. Not surprisingly, are the participants in this webinar interested particularly in the funding? And you said you've invested $1 billion on sanitation and another huge investment plan.
Yeah. So let me.
And we. Do you want to speak a bit to that? Okay, go ahead.
I read the question, and question is, let me clarify the funding. Probably, I think I've not been able to communicate correct figures. So the funding is coming from various sectors, but just limiting myself to sanitation sector and also the water sector by this ministry alone. So the Clean India mission started from 2014 and it went on till 2019. The total investment which has been made has been about $20 billion. $20 billion over a period of time. Now, this is the overall macro picture. In this process, there was a big focus on construction of toilets and toilets with the water facility, and obviously along with the hand washing station. And specifically for each toilet, we were making, apart from the incentive which we were giving to the households, we were giving $25 per unit as assistance for the washing facility. And the total number of toilets which were constructed over the 5-year period were about 100 million, 10 crore to be precise in Indian terms, but 100 million toilets were constructed. Now, the question also has a sub part: what is the kind of money which will be spent in future? Now, in future, Water Mission has also come into picture, and their investment which has been planned is from 2019 onward till 25, they will be spending about $50 billion. So this is a kind of investment for providing functional household tap connections. So this is not exclusively for just hand washing. This is for overall water and sanitation. Apart from this, in future, the sanitation ministry itself, the sanitation program itself has entered into phase 2 of the program, and that will be providing about $23 billion from 2019 up till 25-26. So this is the kind of investment which we are talking about, and it's a huge investment. It is being done in a holistic manner, just not in somebody has raised this question, what is the kind of share with respect to the hand washing? We are not separating it from the overall water and sanitation. So I hope I have clarified the numbers now. These are the numbers which should clarify the huge investment which is being made by Government of India. Yeah. This is the investment. Apart from this, the investment is also being made by the state governments on their own also.
All right,
over to you, Clarissa. So
okay, thanks very much.
There was another question also. There was another question,
yes,
if you want for me to answer that. So I think.
The second question was about access to water or access to soap or hand sanitizer, and I think the question was which one do you find more difficult? Yeah, and I think you've already outlined how you're approaching water supply. Perhaps you could just speak a bit about whether the government is doing anything to try to promote access to soap or hand sanitizer, or is that something you leave up to the private sector? Do you want to just speak very briefly on that?
Yeah, access to soap and sanitizer is not a big challenge. So between the access to water and access to soap sanitizer, the most difficult part is access to water. And the soap and sanitizers we are leaving to the private sector. They are very cheaply available in India. Even the remotest villages, you will get the soap and at a very low cost. So I think I could be brief to this extent. I think that answers your question also, as well as the question which was raised in the Q&A.
Yeah, and I think that this is something in a big country like India, with a very vibrant private sector, probably you have less challenges with access to soap than perhaps in some smaller countries with not such a developed private sector. I want to go back to Ms. Helmi, if she is still there, and ask a question about coordination between ministries, because I thought it was very interesting what Mr. Barocca said about bringing the ministries together, in fact, forming them into one ministry. That's not something that every country does, but I'm just wondering, Ms. Helmi, you're in the health ministry. Did you work with other ministries such as the water ministry? And can you tell us anything about how you achieve that? I hope Ms. Helmi is still listening to us. I can't see her. No, I haven't. Oh, I have a feeling that we've lost the connection with. Oh no, I think she's now coming on. Are you there, Ms. Helmi?
Donc, c'est la coordination, si je comprends, entre les ministères, c'est ça?
You, but if you can speak to the question, we're listening.
Vous m'adressez à moi?
I can hear the translator. Yes, I'm talking to Ms. Yes, I'm talking to Ms. Helmi. I just wanted you to speak as, in the Ministry of Health, how you worked with other ministries, like the Ministry of Water.
Donc, permettez-moi de dire que notre département d'hygiène et de l'environnement, c'est l'interface entre le ministère de la Santé et les autres départements, tels que le ministère de l'Agriculture et des Ressources en eau. Donc, comme vous voulez. Donc, pour accéder à l'hygiène des mains, on doit accéder à l'eau potable, c'est ça? Et donc, le ministère de l'Agriculture, par exemple, elle est responsable pour l'alimentation en eau potable. Donc, on a instauré une bonne relationnelle. On a fait l'instauration des aspects d'hygiène et de santé au niveau des autres départements qui sont en relation avec ces aspects-là. Donc, je m'explique. Donc, on a programmé des séances de sensibilisation auparavant, ça fait des années, pour l'évaluation de l'impact sanitaire et environnemental de tous les projets de développement. Donc, on a pu instaurer cette vision sanitaire dans notre comportement et notre relation avec les autres départements. Donc, cela, je trouve que c'est très important. Donc, on a quelques CSP qui ne sont pas connectés à l'eau de boisson, à l'eau potable. Donc, c'est suite à notre relation avec les autres départements qu'on a pu programmer la connexion de quelques centres de soins à l'eau potable. En plus, si on arrive parfois dans notre contrôle quotidien, on contrôle la potabilité de cette eau qui approvisionne les centres. Donc, si on trouve que, par exemple, le degré de chlore n'est pas conforme, donc tout de suite, on communique avec la SONED qui est responsable pour l'exploitation des eaux pour faire remédier à ces insuffisances-là. Donc, on collabore, on a une collaboration instantanée et même immédiate avec nos collègues dans ces départements qui s'occupent de l'eau. Donc, de même, par exemple, chaque année, on fait la journée nationale de l'hygiène. Dans ces journées-là, qui se tiennent chaque année, chaque année, on choisit un thème, par exemple, l'hygiène de l'eau au niveau des centres de soins. Et donc, on veut inviter tous nos partenaires, que ce soit le ministère de l'Agriculture, de l'Environnement, du Transport, tous les départements, pour les sensibiliser sur l'importance de l'hygiène dans la programmation, dans la coordination des travaux entre l'hygiène, entre la santé et les autres départements. Donc, ils sont sensibilisés, même s'il n'est pas sur le plan, parfois, même si amicalement, ils prennent le téléphone pour nous demander qu'est-ce qu'on fait, est-ce que c'est correct sur le plan hygiène ou non. Donc, on a pu établir une relation très pertinente qui promouvoir la santé et l'hygiène.
Okay, thank you. Thank you for that. And I think it's also particularly inspiring
de même,
to hear.
On a quelques régions. On a justement dans quelques régions, on a la connexion avec l'eau potable n'est pas tout à fait complète. Par exemple, la région de Kérouan, pratiquement 70% de la population est rurale. Donc, on aura dans cette région la génie rurale qui s'occupe de la livraison de l'eau potable. Donc, on essaie de faire l'assistance à travers nos référents hygiène dans cette gouvernorat pour assurer l'approvisionnement en eau potable qui est conforme, qui est une mata sanitaire pour alimenter que ce soit la population ou les centres de santé. Et maintenant, on a un programme très important avec l'UNICEF pour...
Okay, I'm very sorry. We have to move on to the rest of the program. Thanks for your passion and enthusiasm. I found it particularly inspiring that you identified that things like World Hygiene Day and Global Handwashing Day can in fact be an opportunity for people from different sectors to come together. So I think that that's particularly apt to hear that from you on this day. So thank you very much to our panelists. I think we hear from them clear calls for government leadership, for government coordination, and we commend them for the inspiring work that they're doing. And Anne, I will hand back over to you. Thanks again to our panelists.
Okay, thanks so much, Clarissa, Mr. Barroca, Mrs. Helmy, and Licenciada Cruz, and all of those who participated by asking questions for that fascinating conversation. I'm sure this won't be the end of that discussion, but rather the launch of fruitful partnerships going forward and further dialogue in this space. One common need that's come through very clearly today and in the report is that strong leadership in hand hygiene is critical. And I'd like to come back to the case study from Pakistan, as our speaker was able to happily join us again. So I'd like to turn over the video to Dr. Saima Shafiq, the manager of the WASH Strategic Planning Unit at the Government of Pakistan's Ministry of Climate Change, who will share the experience in developing hand hygiene roadmaps. Over to you, Dr. Shafiq.
Yeah, thank you. First of all, thank you to all the organizers who have given us the opportunity to be part of this program and present the case study from Pakistan. Very briefly, I would like to give you an overview and the context of the country. Please move on to next slide. Thank you. Pakistan is the 6th largest country in the world with an estimated population of almost more than 210 million. It's a federation of 4 provinces and the 2 regional territories, including Balochistan, Sindh, Khyber Pakhtunkhwa, Punjab, and also includes Gilgit-Baltistan and Azad Jammu Kashmir, whereas Punjab is one of the largest provinces in Pakistan as far as the population is concerned. It has more than 100 million people inhabiting in this province. So as per the new SDGs, our status of water and sanitation, access to water and sanitation is that almost 88% people, they have the access to limited services of water, whereas 64% are accessing the basic sanitation service, and almost 25 million people are still defecating in the open. Next, please. So just to give you an overview that how Pakistan has evolved in past few years as far as the water sanitation and hygiene programs are concerned. You know, Pakistan is kind of, it has a devolved set of government where provinces are the lead in terms of implementation of the projects, programs and projects that are related to water and sanitation, whereas at the national level, we have the mandate for policy coordination, for policy formulation and coordination at Ministry of Climate Change. But after this current government that came into power in 2018, the Clean Green Pakistan movement becomes one of the flagship program of flagship program at the national level. It has 5 major pillars, and 4 of the pillars are covering the water sanitation and hygiene context. If you see that it has one pillar is around access to safe drinking water, access to sanitation, then wastewater treatment, solid waste management, and 5th pillar is the tree plantation. And under tree plantation, we are mostly focusing on the tree plantation in the urban areas. So, but as you see, the status of hygiene, it is quite variable in the country. If the latest National Nutrition Survey, it reflects that 90% population indicate hand washing practices, but only 54% of the people have reported that they have a hand washing place with soap and water at a dedicated place. So this clearly reflects that how actual practices are taking place, how the practices are on the at the ground level. Move to the next slide. So this has, in 2018, the priority of the current government. And if you see that the COVID-19 pandemic, that has given a very strong message to all the political leaders, to all the political leadership, to all the key stakeholders, to the public sector entities, that we have to emphasize on hygiene. So hygiene was evolved as one of the strongest pillar under water sanitation and water sanitation programs. So this has really mobilized us, and with the support of UNICEF, Ministry of Climate Change has devised these strategic areas for hand hygiene roadmap for all. So one of the key pillars of this hand hygiene roadmap were to emphasize on the political leadership to promote a culture of hygiene across all parts and at all levels. Then strengthening and the enabling environment for hand hygiene was considered as another strong pillar, and sustainable inclusive programming at scale was considered one of the most important link in the hand hygiene for all roadmap program. So the basic focus was to create an impact where morbidity and mortality due to infectious diseases like COVID-19 are reduced. And the outcome we were envisaging were that by 2030, everyone practices hand washing with soap at home and public places and institutes. So hand hygiene for roadmap, hand hygiene for all roadmap was devised with these strategic priorities. Please, next slide. So under the this Hand Hygiene for All roadmap, and implementation framework was devised, and this implementation framework was to create a focus of the government on responding to the control of the outbreak and emergencies, and also to focus on that government ensures that hygiene systems are rebuilt while building back better, and then also focusing the government will reimagine to sustain a culture of hand hygiene to ensure that any improvement initiated as part of current pandemic response continues to be championed over a longer duration of time, and then preventing new and re-emerging infectious diseases can be prevented. Next slide. So under this roadmap, the key strategic actions were defined, and one of the priority intervention or priority action under this roadmap was the political will. Then policies and strategies, yes, they are very important for us. So under those policies and strategies, government has already emphasized on Clean Green Pakistan movement, behavior change communication programs, and nationally determined commitments. They have also emphasized on the hygiene component under the current NDCs. Then institutional arrangement to actually focus on the coordination, standards, and regulatory frameworks for hand hygiene, and then financing, which cannot be neglected in any of the program if we are focusing on the sustainability. So equity-based investments and private sector engagements, including public-private partnerships, are already prioritized under this roadmap. Next slide. Then there were 4 other pillars of this roadmap. One of them is monitoring and evaluation, and also the review process. You know better that any of the roadmap which cannot be monitored is not actually the action that is sustainable. So M&E is part of this roadmap. Capacity development, again, it's a continuous, rigorous process that requires the motivation and definitely making improvements day by day as per the current needs and as per the future needs as well. So capacity development is also emphasized. Then inclusive programming, that is to actually include the rewards for all, proper maintenance and reward for all, and last but not the least, that is the behavior change component, which is to revisit the BCC strategy and also ensure that we are engaging the community both online and offline. So these platforms are being established under this roadmap. Currently, Government of Pakistan is in the process of developing the costing plan of this Hand Hygiene for All roadmap, and the aim of this costing plan is actually to mobilize the financing for for hand hygiene both at the national level and the federal level. So we are hoping and looking forward that in next 1 year, when we will be able to in the next 1 year we will be able to show some results around the hand hygiene roadmap implementation and implementation process as well. So thank you very much. This is all from my side.
Astăzi,
it's not acceptable that over 3 billion people around the world do not have access to basic hand washing. That's why at Kohler Company we're taking action to address this dire need. Through our in-house startup Innovation for Good, we're developing solutions that serve a social good while also help us deliver on our promise for believing in better. On this Global Handwashing Day, let's encourage and inspire others to join us in this movement to develop solutions that serve this basic human right.
Lixil is committed to improving the livelihoods of 100 million people through improved sanitation and hygiene by 2025. In 2020, Sato launched the Sato Tap, an innovative hand washing station that can be used in some of the most underserved communities. We, in partnership with UNICEF and our global partners and the consumers worldwide, hope to roll this out and distribute in 500,000 donated units on our way to a full commercialization of the product.
Safeguard remains committed to the hand hygiene through our Spread Health Across China campaign, which runs from 2020 to 2025. Through this campaign, we aim to reach 100 million people all over China, providing access to hand washing facilities and knowledge, and increase awareness of the significant difference this simple behavior could make. Please come and join us. Let's move forward together to build on this momentum and accelerate progress toward hand hygiene for all.
This Global Hand Washing Day, I'm proud to reinforce our commitment to teaching people across the world at scale good hand hygiene behaviors. We intend to teach 500 million every year, starting in 2021 with our new H for Hand Washing program. This intends to get improved hand hygiene behaviors right at the start by changing curriculum in schools, by changing the alphabet, which normally stands for H for hat, to H for hand washing.
Great. Thanks so much, Dr. Shafiq, for that wonderful presentation. And you've just seen the last round of our video commitments. I'd like to now invite the Director of Environmental Health and Ministry of Health, the engineer Ana Paula Cardoso, to share some quick reflections on the video commitments that we've seen today. Over to you.
Thank you, Anne. It has been inspiring to hear the numerous countries' government commitments. I would like to congratulate the governments of Malawi, Vietnam, and others for their strong commitments. Clearly, there is a global movement building driven by strong political leadership to turn the tide, by strong political leadership to turn the tide on hand hygiene. Political leadership is particularly important for an issue such as hand hygiene, which is so cross-cutting. Sustained progress depends on clarity within government on the roles and the responsibilities of different ministries for different components of hand hygiene and across different settings. This requires strong leadership. In Mozambique, the Ministry of Health is providing this leadership. Next November, the Ministry of Health for the government of Mozambique will launch a national initiative towards hand hygiene for all in Mozambique, which will bring together the necessary ministries to develop a national roadmap for hand hygiene for all. Thank you very much.
Okay, thank you so much, Engineer Cardoso, for those excellent reflections on what we've seen in terms of the commitments coming across sectors today. Over this event, we've heard about the state of the world's hand hygiene, learned how governments are centering their efforts on it, and have gathered momentum from both government and the private sector. I'd like to now invite Dr. Maria Nera, the Director of the Public Health and Environment and Social Determinants of Health Department of the World Health Organization, to talk about where we go from here, our global priorities, challenges, and opportunities. Over to you, Dr. Nera.
Thank you very much, and very critical question. Where do we go from here? I have to say that there are two celebrations every year that makes me feel a little bit sad. One is when we talk about open defecation and lack of facilities for sanitation around the world. And the other one is exactly this one, and a hand washing day. I know that we should be able to celebrate, and I should be able to tell you congratulations and happy day, but somehow it reflects a little bit the disappointment, the frustration of the fact that we still need to promote hand washing now in 2021, in the middle of a pandemic, in the middle of several crises, and trying to go for the recovery after COVID-19. But this is the reality. It's quite alarming, the situation. We are still lagging behind, but still, let's be positive. Let's concentrate on the positive things. And after listening to this fantastic event, I'm trying to be positive and certainly with a lot of energy for what it will be next. And next means that although, as I say, the situation is not very positive in certain things, and then access to hand washing, awareness has been raised. The analysis of our global report on hand hygiene give us very good ideas and tell us that many countries are engaging on good roadmaps. And what I heard now, the commitment, the passion, the description of activities that the countries and the policymakers are doing at the government level, it gives me again hope and optimism for the future. We need to make sure that everybody understands that this is the intervention. If you need to select the one intervention in public health, is you as a country, you need to prioritize how to utilize your budget, your national budget. Please make sure that you invest on hand washing, access to clean water and sanitation. Those are investments that you will never, ever regret. You will never regret. You will see the benefits in so many fronts, in so many diseases that will reduce the cost that you are investing at the beginning. So for me, I finished this meeting with a positive engagement, with optimism. I believe on the huge community that has been engaged today. All of you, I detected an incredible passion. Merci aussi la francophonie et les espagnols qui ont parlé. Bravo todos los que habéis hablado en español. It has been really rich, and I could see how every country is struggling, but still pushing to make sure that this is a priority. The collaboration with UNICEF, our colleagues in UNICEF on this global report is of course fantastic, and I'm sure that by joining our forces and involving many countries, more than 60 governments today were expressing commitments, I think we are gonna make it. So what is next? Keep pushing, keep engaged, keep with the same level of passion, go and convert other people that are not converted and were not participating today, and make sure that everybody understands that this is the only way, and it's probably the most cost-effective investment we can make. So let's go for that, and I hope that this will be as well the feeling of those who have been participating, that although this is alarming, although this is quite sad to see that the world is not investing in what we think it should be the most logical one, there is a space for optimism and hope, and if we are together, we are going to accelerate this effort, and we will go for something that maybe next year we will have even better news. Let's hope that. This will be the first what next after this. Thank you. Over to you.
Thank you, Dr. Nera, for those strong messages and for closing our session today. And thank you indeed to all of our panelists and speakers today, live and recorded. And thank you all to all of the audience members who came out to hear more about hand hygiene and the state of the world's hand hygiene report today. We really appreciate you staying up late, waking up early to join us in this session. I always leave the Global Handwashing Day sessions inspired by the work around the world and recommitted to the effort of universal hand hygiene. We'd really like to hear what you did today in your country, so please do report on what you've done. My colleagues will post a link to the reporting website where we can share all the stories from around the world and package this and report back on what we achieved today. So with that, I'd like to wish you all a great day, great evening, great afternoon, and I look forward to working with you in bringing hand hygiene for all to a reality in the future.